I'm the acting secretary at the Department of Health and Human Services, known as HHS. I'm here to talk about the check that I was just given, written by President Trump to HHS using his third quarter salary, to which HHS is going to devote his donation, America's devastating opioid crisis. Since day one of this administration, President Trump's leadership on this issue has driven action on it across the federal government. Speaking for HHS in particular, earlier this year, we unveiled a comprehensive strategy that attacks the opioid epidemic on 5 fronts. The 5 points are better data on the epidemic, better research into pain and addiction, better pain management, better targeting of overdose reversing drugs, and better prevention, treatment, and recovery services.
Marijuana could be the secret weapon to fighting the opioid crisis. The National Academy of Sciences believes that it works for pain. This year published that. In states where medical marijuana is legal, listen carefully, where it is legal in those states, there's a 25% lower opioid overdose death rate.
I mean, I used to believe that, people who were in favor of medicinal marijuana were just malingering and wanting to get high.
Yeah.
But the truth is that I think for certain people, not only does it work, it can be the only thing that works.
Researchers at the University of California, Berkeley have looked into the issue of opioid use and surveyed people to find out whether or not they are more likely to use opioids for pain management or medicinal marijuana. Now, of the 2,897 patients recruited for the survey, 63% were using marijuana for pain-related conditions such as fibromyalgia, back pain, and arthritis. About 30%, or 841 patients, also reported using an opioid currently or in the past 6 months. Now, here's what they found. Of those, 841, or 92%, agreed or strongly agreed with the statement that they preferred cannabis over opioids for their condition.
Opioid medications, Oxycontin, hydrocodone, and fentanyl represented an almost $2 billion expense for the U.S. Medicare program. The University of Georgia recently published a study noting that the total number of annual opioid prescriptions dropped by 11% in states where medical cannabis was legal.
Actually, I talk about opioid epidemic, but what the real story is the hypocrisy around medical marijuana. Maybe the exit drug to get us out of the narcotic epidemic, but we're not allowed to study it because it's a Schedule I drug, and I personally believe it could help.
Federal government, on this subject, marijuana, and how dangerous it is, has no credibility because of the lack of serious empirical work. It threatens our whole drug policy's credibility. And you're seeing this happen on marijuana in the States.
Talk about marijuana, and in terms of medical, I think I am basically for that. I've heard some wonderful things.
I hope that you will take this into thought. And just remember, whomever uses this will not use it to make them high. They will only use it to stay alive and care for their children who still need them.